Hi, my name is Katie McCurley, and this is my fourth speech for Philosophy 213. So there are a lot of hot topic issues within the medical field, and in recent years, one of the issues that has come to the forefront is the issue of euthanasia. As someone entering into the nursing profession, I'm sure that I will have to have some conversations about euthanasia. Patients have an intimate relationship with their healthcare providers and ask them for advice on life and death issues. So I'm sure that this is something that I will have to face in the future. Currently, euthanasia is not legal in the United States, but today I'm going to make the case that euthanasia is ethically correct using virtue ethics, and urge U.S. citizens to contact their legislatures to create a bill that would legalize euthanasia in the United States. So to start out, I would like to define what I mean by legalizing euthanasia. So the American Medical Association defines euthanasia as the administration of a lethal agent to a patient for the purpose of relieving a patient's intolerable and incurable suffering. So the two words I would really like to emphasize in that definition are intolerable and incurable. This is not a patient that has any treatment options left. They have come to the end of the line when it comes to different things that they can try. They're suffering and they are just waiting to die. I think we can all relate to that. If you've known someone who has battled an illness and passed away from it, nobody ever wants to see someone that they love and care about suffer through something. So I would ask you, if there was a way that you could take that suffering away for someone you loved, would you do it? Now, that may seem like a simple answer to some of us, but there are definitely a lot of people who are opposed to euthanasia, a lot of professions that are against it, and one of the professions where a lot of people are against it is actually the medical profession. And I want to specifically focus on medical professionals because these are going to be the people carrying out these procedures. So it's very important to see what they think in regards of euthanasia. It does make sense when doctors graduate medical school, they have to swear an oath to do no harm to their patients. So it's understandable how a physician could view euthanasia as a way to do that harm. But today I'm going to make the argument that it is actually morally wrong to not offer euthanasia to patients if you're looking at it from a virtue ethics viewpoint. So just to talk a little bit about the character of medical professionals, when you typically think of medical professionals, people think of words like caring and compassionate and wise. We think of them as virtuous people that you can trust with life or death decisions. And if they don't have these kind of virtuous characteristics, people describe them as having poor bedside manner or being cold-hearted. We want to look at our healthcare providers and say that they are good, trustworthy people. That's one of the reasons why the nursing profession has been voted most trustworthy profession for many years now. So since ethics is such an important way in which we look at our healthcare providers, virtue ethics is a perfect lens to view a healthcare issue like euthanasia. So as I said earlier, one of the professions that's most opposed to euthanasia is the medical profession, and that holds true with some of the biggest organizations. The American Medical Association and the American Nursing Association both state that euthanasia is against their guidelines of doing no harm. So that's one of the biggest oppositions, is that doing harm to patients aspect. Another big opposition is that physicians want to maximize all the possibilities available through the medical field. So if they have another option that could give somebody 6 months, even if they're not going to live beyond that, they want to maximize that because they see that as the greatest good. But with virtue ethics, the most important thing is to be a virtuous person and to care for the people around you. And so that would be ending unnecessary suffering, even if you could give someone 6 months. The Internet Encyclopedia of Philosophy defines virtue ethics as a virtuous person is someone who is kind across many situations over a lifetime, because that is their character and not because they want to maximize utility or simply do their duty. So this quote really highlights the difference between virtue ethics, deontology, and utilitarianism. So for an example, if there is a terminally ill patient who is suffering and they come to a physician and ask for euthanasia, a physician may not want to perform it because they feel like they're going against their duty as a doctor, against their oath they made. That would be a deontological standpoint. They're following the rules, they're following their duty, and they're saying no. If a physician doesn't want to perform it because they know that there are other options within medicine that they could utilize, they want the greatest good, they want you to have 6 more months if you could have it, then they're coming from a utilitarian standpoint, which is looking at the consequences. They want the greatest good, they're going to maximize healthcare. But if they use complex thought, they listen to what the patient wants, they're compassionate towards their feelings about the matter, then they would choose to do a euthanasia procedure, and that would be following virtue ethics. Virtue ethics really emphasizes character. It's the one out of the 3 that focuses the most on character. The other 2 doctors are not bad physicians, but the reasons they're not doing a euthanasia is for selfish reasons. The doctor who doesn't want to do it because of his oath is doing it because he personally doesn't want to break his oath. The physician who wants to maximize medicine is doing that because of his beliefs. They're not looking at the patient, what they want, what is necessarily the best for them, and that's where virtue ethics takes a very different angle on it. So one other argument that comes up with euthanasia is a lot of people fear that it could be exploited and used for the wrong reasons. You could have children who want to collect on big insurance policies, or maybe a spouse who is tired of caring for their spouse who is sick. And these are legitimate concerns. These are true cases and things that have happened, which is why I am proposing that euthanasia be legalized, but under a very specific procedure, where physicians would enter into this specialty. They would be especially trained on how to deal with moral issues. They would take classes, workshops. They would be vetted, their background checked out to make sure that they were a person of good quality and of good character in the past. And the decision would be just between the physician and the patient on whether they want the euthanasia procedure. It would not involve any family, friends, any outside influences. For physicians, this would be a really rewarding specialty to be in because you would be ending suffering and helping people who are coming to the end of their life. So with all of this in mind, looking at euthanasia being morally ethical from the virtue ethics standpoint, I urge United States citizens to contact their legislatures to create a bill to legalize the euthanasia procedure in the United States. This is about doing what is right for people who are coming up on the very end of their life. This is about being compassionate and caring. And it's about ending suffering that doesn't need to happen anymore and letting people have autonomy over at least how they choose to go out of this world. Medicine is about saving lives, but there are sometimes more than one way to save a life. Thank you.